Iodine. Providine lodine ointment. Composition. Providine lodine USP 5%, 0.5% available lodine. Ointment base. Description. Iodine plus ointment is a broad spectrum antiseptic for the topical treatment or prevention of infection in minor cuts and abrasion, minor surgical procedures, and small areas of burns, also for the treatment of mycotic and bacterial skin infection, pyoderms, and treatment of infection in decubitus and staph ulcers. Lodine plus ointment contains iodinated providine, a complex of lodine which shows all the broad spectrum germadial activity of elemental iodine. The germadial activity is maintained in the presence of blood, pus, serum, and necrotic tissues. Iodinated providine kills bacteria, virus, fungi, spores, and protozoa. Lodine plus ointment is safer and easier to use than classic iodine preparation and has low systemic toxicity. Iodine plus ointment is a brown color semi-solid mass filled in lavy tube. Pharmacodynamics. Pharmacotherapeutic group. Antiseptic and disinfectant. Iodine plus ointment contain providine lodine, which is a stable chemical complex of polyvinyl pyroiodine and elemental lodine iodine. Iodine plus ointment shows non-selective broad spectrum germadial action and act as bacterial, fungicide, bactericide, spondylite, amoebride, insecticide. Lodine plus ointment does not develop resistance in microorganisms. Iodine plus ointment will not permanently stain skin, natural fibers, or hard surfaces. Iodine plus ointment is less irritation to the skin than condensation lodine preparation. Pharmacokinetics. Iodine plus ointment is applied topically to the affected area. Indication. Therapeutic iodine plus ointment is used as an agent to systemic therapy in following conditions: primary or secondary tropical infection, infected surgical indication, infected discrete or status alters, pyoderms, secondary infection, dermatoses, and infected dermotic lesions. Properly, iodine plus ointment is used to prevent microbial contamination in burns, incidents, and other tropical lesions. For determined skin in hyperalimentation and in care. The use of lodine plus ointment for abrasion, minor cuts, and wounds may prevent the development of infection and permit wound healing. Dosage and administration. For the treatment of infection, apply once or twice daily or at dressing change for a maximum of 14 days. For the prevention of infection, apply once or twice a week for as long as necessary. The affected skin should be cleaned and dried. Apply ointment to the affected area. May be covered with a dressing or bandage. Contraindication. Lodine plus ointment is contraindicated in known or suspected lodine hypersensitive. Regular use is contraindicated in patients or users with thyroid disorder, not for use in infection under 2 years. Special caution is needed when regular application to broken skin are made to patients with pre-existing renal insufficiency. Regular use should be avoided in patients on concurrent lithium therapy. Special learning and precaution for use. Use of the preparation may interfere with test of thyroid function. Iodine is absorbed throughout burns and broken skin and to a lesser extent throughout intact skin and may lead to toxic level of iodine in the blood, particularly in patients with renal insufficiency. If symptoms occur suggesting change in thyroid function, these should be investigated. In patients with impaired renal function, blood levels of iodine should be monitored. If local irritation and hypersensitivity develop, then discontinue treatment. Iodine plus ointment can permanently discolor white gold jewelry, and it is recommended that this type of jewelry should be removed before using iodine plus ointment. Interaction with other medicine and concomitant use. Absorption of iodine from providine iodine may interfere with thyroid function test. Contamination with providine iodine of several types of tests for the detection of occult blood in feces or blood in urine may produce false positive result. Use with concurrent lithium therapy has been shown to exhibit addictive hypothyroidic effect. Absorption of iodine from providine lodine throughout either intact skin or broken skin may interfere with thyroid function test. Contamination with providine lodine of several types of tests for the detection to occult blood in feces or blood in urine may proceed a false positive result. Pregnancy and lactation. Regular use of providine lodine should be avoided in pregnant or lactating women as absorbed low iodine can cross the placental barrier and can be selected into breast milk. Although no adverse effects have been reported from limited use, caution should be recommended and therapeutic benefit must be balanced against possible effect of the absorption of iodine and factor thyroid function and development. Effect on ability to drive and use mechanics not available. Undesirable effect. Iodine plus ointment contain providine lodine may produce local skin reaction, although it is less irritant than iodine. The application of providine iodine to large wounds or severe burns may produce systemic adverse effects such as metabolic acidosis, hypertenemia, and impairment of renal function. Overdose. Deliberate or accidental ingestion of large quantities of providine lodine will result in high blood concentration of iodine and gastrointestinal corrosive effects including vomiting, diarrhea, and abdominal pain. Systemic toxicity may result in shock, hypotension, tachycardia, fever, metabolic acidosis, and renal impairment. Symptomatic and supportive treatment should be started with the special attention to monitoring electrolyte balance, renal function, thyroid function, and liver function. Hemodialysis effective clearance iodine should be employed in severe cases of iodine poisoning, particularly if renal failure is present. Continuous venous hemodiafiltration is less effective than hemodialysis. Incompatibility not available. Shelf life 24 months. Packaging. A brown color semi-solid mass filled with lime tube of 15 gram enclosed in a printed carton along with pack insert. Storage condition. Store in dry place below 30 Celsius. Protect from light. Keep out of reach of children.